You are welcome to my channel. How is the pregnancy journey going? I wish you a safe delivery. In this episode of Antenatal Health Talk, I'll be talking about the danger signs in pregnancy. And if you've not watched the previous episode of my Antenatal Health Talk, I'm going to be leaving the link in the description box. During pregnancy, there are some signs that when you see, you rush to the hospital immediately in order to get medical attention. And even though the signs you are feeling are not among the signs I'm going to mention right now, anything you feel different during pregnancy, make sure you talk to your healthcare provider so that you can get the right information and actions can be taken quickly. Never take any signs to yourself or comparing it to your previous pregnancy, especially if it's not your first pregnancy, or if this is your first pregnancy. Don't take the chances of just asking someone around to ask if what you are feeling is normal. Make sure you go to the hospital in order to get the right attention. Danger signs in pregnancy. First is the feeling to hurt oneself. If during pregnancy you have this feeling to harm yourself or to harm your unborn child, you should discuss this with your healthcare professional in order to get the right information and the right treatment. The second danger signs during pregnancy is bleeding. Bleeding is a medical emergency that at any stage of your pregnancy, if you see blood, you should rush to the hospital in order to seek medical attention, because bleeding can be life-threatening to both the mother and her unborn child. Now, let's look at some of the causes of bleeding during pregnancy. One of the causes of bleeding during pregnancy is implantation bleeding. Implantation bleeding occurs before the second month of pregnancy and it can come as spotting or a light bleeding. Not all women experience implantation bleeding. And what causes implantation bleeding? This is when the growing fetus embeds in the uterine lining. The second cause of bleeding during pregnancy is placenta previa. In placenta previa, the placenta covers the opening of the cervix and causes bleeding. This condition can be life-threatening to both the mother and her unborn child. Then, the third cause of bleeding during pregnancy is placenta abruptio. Usually, the placenta separates after the baby is born, but in the case of placenta abruptio, while you are still pregnant, the placenta detaches from the uterus, causing bleeding. In this case, it can come with cramps, it can come with abdominal tenderness, and it can also put the baby in distress. Any form of bleeding during pregnancy is a medical emergency. So no matter the stage of your pregnancy, if you see blood or if you see a brownish discharge, make sure you rush to the hospital in order to seek medical attention. The third danger signs during pregnancy is convulsion. Convulsion is characterized by episodes of seizures, disorientation, and confusion, and this is called eclampsia. Eclampsia occurs in women who previously have pre-eclampsia, and pre-eclampsia is characterized by high blood pressure and protein in urine. This is a medical emergency which can be life-threatening to both the mother and her unborn child. The next danger signs during pregnancy is headache. Headache could be caused by hormonal changes, stress, or poor nutrition. But if you have a headache that stays long and doesn't go away and becomes severe, you need to talk to your healthcare professional, because headache can sometimes be caused by high blood pressure. The next danger signs during pregnancy is blurry vision. When a pregnant woman experiences changes in her vision, sensitivity to light, seeing light spots or hot or flashes, she should quickly report to her healthcare professional, because this can be linked to eclampsia. Abdominal pain during pregnancy could mean contractions, and contractions could mean that the baby is coming before time, especially when this occurs in the early phase of your pregnancy. Any abdominal pain you experience during pregnancy, you should report to your healthcare provider, because there are some certain things that can be linked to abdominal pain during pregnancy, like placenta abruptio, which we just discussed earlier. Difficulty in breathing. During pregnancy, women might experience difficulty in breathing because of the growing uterus pressing on their lungs, giving less way for oxygenation. But if you experience difficulty in breathing when lying down, or finding it difficult to breathe when lying down, you feel like your breath is about to cease whenever you lie down, but you find more comfort when you sit down, you should report to your healthcare provider. And before that, no matter any kind of difficulty in breathing you are having, make sure you've talked to your healthcare provider about it, because the difficulty in breathing you have when lying down and find comfort whenever you are sitting would mean a congestion in the heart. Swelling on the face and feet. Women might experience swelling on their face and feet during pregnancy, but not all women experience that though. During pregnancy, because of the slow return of blood flow, and when this is accompanied by pitting, in a case where you press on the swollen area and you see your finger sign on it, it's calls for a medical emergency and you should report to your healthcare provider immediately you experience that. The next danger sign is reduced fetal movement. Make sure you note the movement of your baby throughout your pregnancy so that if there's any change in how you usually feel the movement of your baby, you should report to your healthcare provider. Draining before 37 weeks of gestation. During pregnancy, the liquor, which is the water that the baby is in, it serves as a lifeline, nourishing the baby and protecting the baby. So when you experience water coming out from you and you are not up to 37 weeks of pregnancy, you should report to your healthcare provider in order not to endanger your unborn child. Thank you for watching this episode of my Antenatal Health Talk, and don't forget to subscribe and tap on the bell to get notifications anytime I post a new video. In the next episode of Antenatal Health Talk, I'll be talking about malaria in pregnancy. See you in the next episode.